Getting ready for your IVF cycle. While it's true that the IVF treatment takes place in the IVF clinic and in the IVF laboratory and is done by medical specialists, nurses, doctors, and embryologists, there is a lot which you as a patient can do prior to starting the IVF cycle to make sure that you're going to get the best chances of getting pregnant. What do some of these things include? Some of it is pretty much common sense. You need to be in good health, you need to stop smoking, you need to stop drinking, you need to be well prepared, you need to be taking supplements like folic acid, you need to have done all your tests, you need to be well organized. But there are two important things which you need to do to get ready for your IVF cycle. The first is arming yourself with what I call information therapy. You should read as much as possible from as many reliable websites as possible. I understand that a lot of the information can be intimidating, it can be confusing, and that's why it's so important that you don't just go to one single website. Try two or three, and preferably reliable websites. Our website at drmalpani.com is very reliable because I've authored the information, but you can get equally reliable information from, let's say, the Harvard website or the Hopkins or WebMD. Once you keep on looking at the same information on different websites, a lot of these terms which originally may seem very difficult or complicated, like what's a blastocyst or what's superovulation, will actually become easier because repetition will make it easier. My one request to patients is please never underestimate your intelligence. Never think that IVF is so complex that I can't understand it. And don't think that doctors have two brains or that we're super intelligent or only we can understand what's happening in an IVF cycle. And in fact, if you have a doctor who tells you, oh, don't worry about it, I will do everything for you, don't ask me questions, you're not going to understand anything I'm saying, that's a huge red flag. Good doctors appreciate patients who do their homework, who try to find information for themselves, because these patients have realistic expectations. They understand that the outcome of an IVF cycle is not certain, that it can be an emotional roller coaster ride, but they're much more prepared for the roller coaster ride because they know what to expect, what's going to happen, what the doctor can do, and equally what the doctor can't do. Information therapy in this day and age is a no-brainer. Lots of videos on YouTube, lots of books, lots of websites, so make sure that you're well informed. And this information will help you do the second most important thing prior to your IVF cycle, which is selecting the right IVF doctor. Because the reality is not all IVF doctors are created the same. Some won't spend any time with you, some will never be in the clinic, some will make an assistant do all the work, some are completely unapproachable, some will hide information from you so you don't have any idea of what's happening, and that's completely unacceptable. In an IVF clinic, the most important person is the patient, and you want a doctor who's answerable, transparent, responsible, who will share information with you. And that's why after you've armed yourself with information therapy, so you know exactly what the IVF process involves, so that no one can take you for a ride and no one can cheat you, you then need to start asking questions prior to paying your money for your IVF cycle, not afterwards. Which means, do you provide photographs of embryos to all your patients routinely? And do you only do blastocyst transfers? And the right person to ask this question is actually the receptionist when you're taking an appointment. And if the receptionist says, yes, of course we do, and we do this proactively, you know you're in safe hands. Whereas if the receptionist looks puzzled and says, what's an embryo photo? And no, we don't do that. That obviously means that this clinic is not willing to share information with patients. And that's a red flag. So that this information therapy will help you reduce your anxiety and stress levels because you know exactly what to expect in an IVF cycle, that it's a safe medical treatment with a high success rate if you go to the right doctor. And equally importantly, this information therapy will find you the right doctor, someone who respects you, someone whom you can trust because he shares information with you. So think of it as the homework which you need to do in order to pass the IVF exam with flying colors. The good news is it's become very easy to do this homework and you can actually do it free online.